Joined now by Professor Tulio de Oliveira of the KwaZulu-Natal Research and Innovation Sequencing Platform, Krisp. Prof, thank you so much for chatting to us this evening. So the numbers, the new cases, they do seem to be on a downward trend, markedly so in Gauteng. But we also know that we've got 17,000 people in hospital. With a view to the President addressing the nation on Sunday night, do you think it would be safe to ease some of the restrictions we're currently living under?
Yeah. Good evening, Sally, and good evening to all your viewers. So yes, I do think that would be safer to kind of try to decrease the restriction, potentially to level 3 or what they call a just level 3. The reason from that is that the numbers are still very high, but what we see is the trajectory going in the right direction. What it means, not only day by day or weekly by weekly, that's the safest data to see, the 7-day average is decreasing, but we also see that decreasing across the whole country, just potentially suggesting that the level 4 restrictions have played the role, and then potentially allowing the country to release a little bit the level of restrictions so we can increase some of the economic activities.
One of the things that is looked at when assessing if infections are moving in the right direction is the reproduction factor. In other words, if one person has it, the reproduction factor of 1 would mean that they pass it on to one more person. Anything over 1, my understanding, is dangerous. Where are we currently?
Okay, yeah. Again, Sally, that's potentially the most important statistic that we should give an eye, that we keep our eye, and normally we do calculate that every day. So at the moment, the reproductive number of infections in South Africa is below 1. And our most affected province by the third wave, Gauteng, it's below 0.7. At the moment, it's 0.66, which really show that the number of cases are decreasing very, very fast. We also saw the number stabilizing at 1 in some of the provinces that seem to have hit potentially the top of the third peak. That's more specifically the Western Cape and the Eastern Cape. And then the big question to all of us is what's going to happen in KwaZulu-Natal, because KwaZulu-Natal, we see the reproductive number very low, but we know that was caused by the past week and a half of a really disturbance in testing. So that's the province that we are all keeping an eye, because the last 2 days saw similar infections as 7-8 days ago, and that's the one that we want to see if it will confirm that have peaked and go down, or if maybe we're going to see an increase on the third wave doing a lot to the protests and disturbances.
So good news, but we have to be very careful, keep an eye on those numbers. You monitor genetic mutations in the vaccine. There's small changes all the time. I want to know if you've seen any significant mutations lately, and if you've seen any sign of Delta Plus or Lambda popping up in South Africa.
Okay, so as we do that as a network of laboratories in the country, together with many of the universities and the NICD, and at the moment what we see is a completely domination of the Delta variant. The Delta variant is the one that's not only dominating the infections in South Africa, but everywhere in the world. This week was highlighted that's beginning to be responsible for 80% of all the infections in the United States of America. And the Delta variant is very, very highly transmissible. And that's why at the moment we don't see any other variants starting to cause large number of infections, because the Delta is so transmissible that's taking over. So at the moment, we don't have any increase of case of Delta Plus. We had 2 cases in South Africa, but that's over 12,000 genomes, so it's a very small percentage. And the Lambda that many people were worried a few weeks ago, not only have not been detected in South Africa, but the World Health Organization on the Evolution Working Group, which I am a a member of that, has decided to keep that variant as a variant of interest because we don't see growing in many areas of the world. So when it starts growing in many areas of the world, we move to the variant of concern. So at the moment, we are still very interested in the Lambda variant that causes major infections in the west of South America, but we are not concerned of that neither in South Africa or Europe or North America or Asia.
One thing I have to ask you about is the 28 deaths that the Health Products Regulatory Authority mentioned in Parliament that occurred after people were given the vaccine. They're very careful to say there's no sign that the deaths were caused by the vaccine. Nevertheless, they're being super transparent to say, let's look into all of this. It's a sort of thing that will frighten people who are vaccine hesitant. What is your message to those people?
Yeah, the message to those people is that at the moment, and this week we crossed the 6 million doses or people that got vaccinated in South Africa, and then the 28 that is really small. It is unfortunately some people, and it's a very rare event, will die or be hospitalized after the vaccine. But the best example that we have that is at the moment what happened in the United Kingdom. So, for example, they have over 50,000 infections a day, which is a shocking number, even for South Africa. We do get worried when we get close to 20,000 infections a day. But they have very, very negligible or almost no deaths. And sometimes that will happen in vaccinated person, but this is a very rare event, which is really a proof that the vaccines are quite effective. So imagine if you divide 28 by 6 million doses, you're going to see that is a very, very small percentage.
Yeah, and I think, of course, it's important to remember that any medical intervention does come with some potential risks. And the stats on vaccines show that it is one of the safest medical interventions. And thank you so much for chatting to us this evening, Professor Tulio de Oliveira of the KwaZulu-Natal Research and Innovation Sequencing Platform, Krisp.